Hand hygiene is a general term referring to any action of hand cleansing.
Hand hygiene includes applying an alcohol-based hand rub to the surface of hands, including liquids, gels and foams, or washing hands with the use of a water and soap or a soap solution, either non-antimicrobial or antimicrobial. When performed correctly, hand hygiene results in a reduction of microorganisms on hands.
The WHO have developed posters on how to hand rub, as you can see in this picture. Recommended time for hand rub is between 20 to 30 seconds.
The WHO have developed posters on how to hand wash, as you can see in this picture. Recommended time for entire hand wash is between 40 to 60 seconds.
Note: wearing gloves does not replace the need for hand hygiene. Gloves do not provide complete protection against hand contamination. Microorganisms may gain access to the healthcare worker's hands via small defects in gloves, or by contamination of the hands during glove removal. Microorganisms colonizing the patients may be recovered from the hands of approximately 30% of healthcare workers who wear gloves during patient contact.
When should gloves be worn? Risk of contamination of the healthcare worker's hands with blood or body fluids. Where indicated by local infection control policy, for example with transmission-based precautions.
When should gloves be changed? Between different patients. During the care of a single patient, to prevent cross-transmission of body sites. Hand hygiene is required with glove use. Before putting on gloves. And after removing gloves. Please note that single-use gloves should not be washed, but discarded.
Alcohol-based hand rub is the gold standard of care for hand hygiene practice in healthcare settings, whereas hand washing is reserved for situations when hands are visibly soiled, or when gloves have not been worn in the care of a patient with C. diff infection. Hand hygiene products and gloves should be made available inside isolation and contact precaution rooms to allow for appropriate hand hygiene to occur during the care of the patient. Prolonged and indiscriminate use of gloves should be avoided, as it may cause adverse reactions and skin sensitivity.
Alcohol-based hand rubs should be used when hands are visibly clean, instead of hand washing, because they 1. Significantly reduce bacterial count on hands. 2. Require less time than hand washing. 3. Are more accessible. 4. Are self-drying. And 5. Are gentler on skin and cause less skin irritation and dryness than frequent soap and water washes, since all hand rubs contain skin moisturizers.
5 moments for hand hygiene. This poster developed by WHO and is a clear guide for 5 moments of clinical hand hygiene.
Moment 1, before touching a patient, for example. 1. Touching a patient in any way. 2. Any personal care activities. 3. Any non-invasive treatment. 4. Any non-invasive observations. 5. Preparation, administration of oral medications. And 6. Oral care and feeding.
Moment 2, before a procedure, for instance. 1. For cannulation. 2. Preparation or administration of any medications given via an invasive medical device, preparation of a sterile field. 3. Administration of medications where there is direct contact with mucus. 4. Insertion of, or disruption to, the circuit of an invasive medical device. And 5. Any assessment, treatment and patient care where contact is made with non-intact skin or mucous membranes.
Moment 3, after a procedure or body fluid exposure risk, which is obviously after any moment 2. and after any potential body fluid exposure, for example. 1. Contact with a used urinary bottle, bedpan. 2. Contact with sputum either directly or indirectly via cup or tissue. 3. Contact with used specimen jars, pathology samples, cleaning dentures, cleaning spills of urine, feces or vomit from patient surroundings, after touching the outside of a drain. And 4. Contact with any of the followings: blood, saliva, mucus, semen, tears, wax, breast milk, colostrum urine, feces, vomitus, pleural fluid, cerebrospinal fluid, ascites fluid, organic body samples such as biopsy samples, cell samples, lochia, meconium, pus, bone marrow, bile.
Moment 4, after touching a patient. Perform hand hygiene before you leave the patient zone.
Moment 5, after touching a patient's surroundings. After touching the patient's immediate surroundings when the patient has not been touched. Patient surroundings include bed, bedrails, linen, table, bedside chart, bedside locker, call bell, TV remote control, light switches, personal belongings such as books, mobility aids, chair, footstool and monkey bar.